Hey everyone, it's Matt Piggott here. I'm one of the medical first responder educators here within HRFE. And if you've been following along our ELC, I've been putting together some medical first responder continuing medical education modules for you to check out. If you haven't done so, go check it out already. However, if you're tuning into this lecture, hopefully you're about halfway through Naloxone or Narcan administration. So I've already talked a little bit about Naloxone, what it is, common opioids that we see, how this affects our central nervous system or CNS, and what is happening inside the brain when we're giving Narcan or when someone overdoses on an opioid. So I'm going to visually kind of draw that out. And keep in mind, I'm no artiste, but just try to follow along here. So here's our brain. So inside our brain, I'm going to draw with a red marker our opioid receptor sites. So every brain has opioid receptor sites. So here's a receptor site, here's a receptor site, here's a receptor site, there's a receptor site, so on and so forth through our brain. So when someone takes an opioid, so I'm going to represent opioids with, I got green and blue magnets. So when someone takes an opioid, we'll say someone's taken Dilaudid for pain. Maybe they have severe back pain. When someone takes Dilaudid, the opioids go in to the receptors and they bind to the opioid receptor sites. They lock in. So that's the Dilaudid, it goes in, binds to the opioid receptor sites. Then the therapeutic effect is released. So people start to feel the pain relief, they feel more relaxed. That's great, that's good. But what happens when people overdose on this, they take too many Dilaudid, it overwhelms the opioid receptor sites in the brain, and all of them get occupied, and then we start to see those CNS or central nervous system effects. So the heart rate decreases, our respiratory rate decreases, their level of consciousness decreases, and this is when we think about possibly having to give Naloxone or Narcan. So how does this work inside the brain? Well, Naloxone is going to be represented by these orange magnets. So the green and blue are the Dilaudid that the patient has taken, and now you can see the opioid receptor sites here are saturated. There's too many Dilaudid, so our patient has lost consciousness, they're barely breathing, their heart rate's low. So we're going to go ahead and give Narcan. And Naloxone actually has a higher attraction rate to these opioid receptors in the brain than opioids themselves. So what it does is when we give Naloxone, it goes into the brain and it binds to that receptor site and it bumps off, the Naloxone bumps off the Dilaudid or the opioids themselves. This is when we start to see the positive effects of Naloxone. So our patient's respiratory rate increases, their heart rate may increase, they may become more alert and oriented because Naloxone has displaced those opioids on the receptor sites. The only thing we need to be cautious of is if someone's taken a lot of opioids, as soon as the Naloxone starts to wear off slowly, so it starts to drop off those receptor sites and go away, what's waiting right there to bind back on? That's right, it's the opioids. So they swoop back in, and then all of a sudden you're gonna start seeing those negative CNS effects. So our heart rate's gonna go down, our respiratory rate's gonna go down, our blood pressure's gonna go down, our patient's gonna become less responsive, and we're gonna have to think about giving more Naloxone to, again, bump those opioids off the receptor sites to keep our patient alive. Now, why is Naloxone such a safe and effective medication to give? Because if someone like you or I, who hopefully right now is not on opioids, although we have the opioid receptors in our brain, if you were to give me Naloxone right now, it'll bind to the opioid receptors, but it's got nothing to kick it off. So you're not even gonna know that you gave me Naloxone. It's completely safe and effective to use. It only works on opioids. If someone has taken an other drug or overdosed on an other drug that is not an opioid, then Naloxone is gonna be ineffective or not work. Hopefully that makes sense. Enjoy the rest of the module. If you haven't checked them out already, go to the ELC, check out our medical first responder, continuing medical education. Thanks everybody.